22 years ago, Humanitarian Help for Uganda was born through exchange visits between the Archdiocese of Mbarara, through the then Archbishop Paul Kebachenga, may his soul rest in peace, and Thomas Hans Pankoke. Today, we have 14 ambulances in total.
We are glad as a hospital to have had an opportunity to be counted among the bases that received ambulances. We started using them in 2013. Before we received the ambulances, we had a number of challenges. We had cases of women dying in villages because they could not reach the hospital on time. And even their babies, most of them died due to lack of transport means to effectively take them very swiftly to the hospital.
At first, as a hospital, we had improvised. We didn't have a standard ambulance. It got a pickup, it put a kind of a box to work as an ambulance. When Humanitarian Help learned that Villa Maria had a need of an ambulance, they donated a single stretcher ambulance, and it was the first standard ambulance in this hospital since it was established in 1902.
I'm glad to report that in 2014, through one of the Montfort Missionaries, Father Charlie, through his friend, the German friend, Mr. Thomas Pakonke, the director of Humanitarian Help, German, we were able to receive 2 ambulances, one a 4-stretcher ambulance and a 1-stretcher ambulance. I must say that from that period, one of the quick services that we've been able to provide and something that we are proud of as an institution is a quick response to emergencies. We don't only respond to accidents, but we do also do referrals from our own hospital to other referral hospitals.
One of the achievements we have so far had is really saving lives of mothers and their babies. We are able to collect them from villages and even from health centers, lower health facilities. Monthly, on average, we receive 40 calls, and we see that every other month they go increasing, which means people are really interested in these services.
These ambulances have helped us to rescue quite a number of lives. And we are the only referral hospital covering 4 districts. That is Sembabule, Kalungu, Bokoma Nsimbi, and Gomba. We are the only hospital in those 4 districts, so they all refer to us. So on many occasions, they call us to go and pick patients that needed to come to our facilities.
One of the good services that we've so far offered within the public is quick responses to emergencies. Averagely, we transport about 40 patients on a monthly basis, and out of them, majority of them actually are mothers. I must say we've contributed a lot in reducing maternal deaths by responding quickly to the calls that have been called upon to our emergency response teams.
I really want to express our gratitude, the director and the staff members of the Humanitarian Help for Uganda, for sending us these ambulances. We are very grateful, and we pray that God really keeps helping them to help the poorest of the poor as their desire stands.
After the single stretcher ambulance, we received a 4-stretcher ambulance. Then the community was very happy because that ambulance carries 4 patients at once. Even policemen usually call us to come and reach where there are accidents that involve many people. We take that full stretcher ambulance. And in fact, these ambulances have helped us to rescue quite a number of lives. So we are really very grateful to Humanitarian Help for Uganda. Because of the donation of these ambulances, we have saved a number of lives and we are still saving many.
I want to take the opportunity to thank our partners from Germany, especially the Director, Humanitarian Help for Uganda, for the support he has offered to the hospital in terms of hospital supplies, logistics, some of the items equipment that is normally used for making diagnosis for the patients, and most importantly, capacity building. We have a number of volunteers, about 17 of them, that help in working on these emergencies. We really want to thank you for that support. And I believe if we continue with the support, we shall continue supporting, improving on the livelihoods of Ugandans.
So while responding with our ambulances, we also realized that there were people started calling us for fire emergencies, but we didn't have a fire truck because in Uganda, firefighting services has been a mandate of only the police. So Thomas again thought about it. Actually, he witnessed one of the scenarios in Chambura when the whole trading center was burnt by a fuel trucker. And again, he was inspired to start this project with the help of the Archdiocese and our national coordinator, Father Ernest, and the team. They started the process of the truck. We received the truck as a gift from the City of Verl fire station. We received it. It's a 2,500 liter truck, so it can stop any fire.
The launch of the Humanitarian Help for Uganda offices. It's a center that has offices, it has the stores that are storing our spare parts, our equipment that we need in the hospitals, and the uniforms. But also we have the call center where the telephones will be received and dispatched to various areas of need. For example, if there is an emergency that needs an ambulance or a fire outbreak that needs a fire truck, then it will be the role of the call center to dispatch this. So the firefighting team and the ambulance teams are here to support the community in dealing with these emergencies. They are here to support the communities in maintaining life. We want to save life, and that is why we are starting these services for the benefit of the community. So it's all for the community. It's all meant to support the good of the community. The fire truck is for them, the ambulance services are for them, so it's the community to support.
Die Idee, einen Verein zu gründen, wurde im Mai 2001 von Thomas Pankoke nach einem Besuch mit seinem Freund Matthias Bönsmann, der zu der Zeit Vikar in Verl war, geboren. Thomas sah die armen und kranken Menschen und erkannte die Bedürftigkeit nach Hilfe.
As many of you know, the organization was founded in May 2001 by Thomas Pankoke. The idea of founding an organization with a specialization in the medical sector in the first place arose after visiting Uganda together with his friend, the Vicar of Verl, Matthias Bönsmann. Thomas saw the poor and the sick and recognized their need of help.
Mittlerweile hat der Verein 126 Mitglieder. Alle Projekte hier in Uganda werden ausschließlich durch Spenden finanziert. Zum Beispiel durch Aktivitäten, die wir durchführen, wie der jährliche Uganda-Lauf im August oder der Verkauf von Getränken auf dem Weihnachtsmarkt.
Now the organization has 126 members already. All projects here in Uganda are financed through donations and activities such as the annual Uganda race in August or selling crepes and delicious drinks at the Christmas market.
Die Arbeit der Mitglieder sowohl in Deutschland als auch in Uganda erfolgt ehrenamtlich. Gerade dafür sind wir als Vorstand mehr als dankbar.
The work done by the members in Germany as well as here in Uganda is voluntarily. For this in particular, the board, are more than grateful.
Die Organisation Humanitäre Hilfe für Uganda, Verl e.V., unterstützt mittlerweile 6 Krankenhäuser, 18 Gesundheitszentren und ein Waisenhaus in Uganda.
Currently, the organization Humanitarian Help for Uganda is looking after 6 hospitals, 18 health centers and 1 orphanage.
Darüber hinaus konnten dank unserer Schulpaten viele Kinder zur Schule gehen.
Additionally, many children are able to go to school thanks to the school sponsors.
Damit sich die Hilfe durch Rettungswagen schnell und gut entwickeln konnte, brauchte es nun eine Leitstelle. Daher erfolgte im Jahr 2021 der erste Spatenstich. Und heute sind wir alle hier versammelt, um die Leitstelle für Notfälle der Feuerwehr und der Rettungswagen zu eröffnen.
In order to get fast deployment for the ambulances, we needed a call center. So the first groundbreaking was in 2021, and today we are all assembled here to open the call center for emergencies concerning the fire department and ambulances.
Über 50 Krankenschwestern und Pfleger, Hebammen und Ärzte sind im täglichen Einsatz, um in Uganda Leben zu retten. Sie alle sind ehrenamtliche Helfer.
Over 50 nurses, midwives and doctors are on duty in order to save lives in Uganda. All of this is voluntarily.
Wir hoffen aufrichtig, dass Sie eines Tages für Ihre unglaubliche Arbeit belohnt werden.
We really hope that these strong helpers one day get righteous rewards for their incredible work.
Abschließend möchte ich Ihnen herzliche Grüße von Thomas überbringen, der an dieser Veranstaltung leider nicht teilnehmen kann, aber im Geiste und in unserem Herzen bei uns ist. Vielen Dank.
Lastly, I want to send greetings from Thomas, who was not able to attend this launch physically but is with us mentally and in our hearts. Thank you so much for your attention.
Thank you.
We also need to plan for rural firefighting services. And we are making an attempt. We are making an attempt as a church, and we hope that the government can support us to bring more fire engines, to place them in different corners of this region, to partner with the government in the development of our nation. Different communities on the hill. I think you are the immediate beneficiaries. We all have to learn how to deal with fire emergencies and health emergencies, so we need to be trained. Thomas is a very simple man, full of faith and man full of energy and man full of dreams. So we thank him and we thank you who are working closely with him. And we ask that you extend our gratitude to him and the message that we are praying for him and hoping that he gets better and comes back to us and works very actively with you. Thank you very much and may God bless you.